Your Majesty, Your Excellencies, ladies and gentlemen, thank you so much for coming to this event tonight. It means the world to us, and we're extremely grateful for all of you that have made it through the incredible New York traffic. So it is a pleasure, and this occasion should have been an occasion for a call to action, but actually dementia is now in the declaration, and on Thursday this will be official. So thanks also to the WHO that has enabled for this to happen. We know now that is in the NCD declaration. So this today is a cause for celebration and joy in our community. So we will focus this panel on what happens next. What is the implementation, the route? What does it mean for all of us? So first of all, the panel is hosted, as you know, by myself and Dan Chisholm, the speaker after me, of the World Health Organization. We're very grateful for them to be the co-host of this meeting. And I want to give a special thanks to the Mary Oakley Foundation and the Diane and Dan Richer Foundation that have enabled this event to happen. As many of you know, we were established in '84. We have the Federation of 105 Alzheimer's Associations around the world, and we represent everybody, and we promote World Alzheimer's Month, the World Alzheimer's Report, World Alzheimer's Day. But our vision is prevention, care, and inclusion today, as we all hope for a cure tomorrow. But the cure and a lot more science are arriving, so our world is changing very rapidly now. We are a not-for-profit organization, so if any of you would feel like making a donation, you're always very. We have something coming up in December on diagnostics. Please come and follow us for that, and something in Lyon where we will all be together and discuss what's happening in our world today. And now to the crux of this presentation. So dementia for many years, although it was formally included in the idea of non-communicable diseases, but has been excluded as one of the major non-communicable diseases. And this is in part due to stigma. People didn't talk about dementia for a very, very long time. So, but it has been out of plans, platform, budget strategies, and that has had a consequence for our members around the world. And this year, this is changing. So one of the important things is what is happening in the prevention and control of NCDs. And this is the first step to increasing the visibility at NCD level. What has happened to a lot of our members around the world was when they went to speak with the Ministry of Health and talking about NCDs, they were basically told that dementia was not an NCD. So they've not been able to participate in campaigns that have to do with prevention and risk reduction. And we have to change that. And this change in part came from an article that we published with Louis Arthurton and a number of people at ADI in Nature Reviews Neurology this year, where we pointed out that dementia will become the third leading cause of death globally by 2040. We have some copies of the article. It's very short here tonight, if you want to read it. And dementia is also projected to be among the top 10 causes of death in 166 countries. We felt it was very sad, in a way, to focus on that. But if this is the only way that people will listen to us, then that is the way. And this is the map of dementia mortality by 2040. So dementia will be the first cause of mortality in all the countries that you see in deep red. And that is a lot of countries. Just last week, Australia declared dementia as being the first cause of death in Australia, for example. So please read the paper and generally speaking, talk about this more, because this is the way to get to governments, and we will hear tonight from some of our wonderful panelists around that. Tackling risk reduction factor is important. 40% of cases of dementia could potentially be delayed or reduced. And so the call to action is essentially to embed now NCDs more fully into the global dementia discourse. And for the global dementia discourse on NCDs, and Katie will tell us more about that later, to include dementia more fully in their thinking. And now I'm going to hand over to Dan for this part of the presentation.
Thank you so much, Paula. Your Majesty, Excellencies, ladies and gentlemen, it gives me great pleasure to be part of this and for WHO to be co-hosting this significant event with our old friends and partners, ADI. The WHO would really like to lend its voice to this issue and be part of not just a call, but let's say a plea for greater action, investment, and attention and visibility to dementia. I think the reasons are manifold. Paolo already provided a couple of statistics, and I won't add many more. I'll just go with one that always somewhat haunts me, which is the sheer number that we are talking about. So right now in this year, we have an estimate of around 57 million people with dementia around the world. And just in 2030, not far away, around 78 million. And the projection is that by 2050, that number will double yet again by a factor of 2, doubling. So I think put quite simply, that means that not only the world is not doing enough now, but it's deeply unprepared for the future about what is to come. And yet we know what to do. Maybe I can put up the action plan. The good news is that we have the commitment, we have the mechanisms, the strategies about how to mount an appropriate and a sustainable and comprehensive response. And just this year, the member states of WHO have agreed to extend the global action plan on the public health response to dementia to 2031. So we have this very strong political commitment to improving the situation. Now, if I can just go to the next one. There are several strategic actions that I put up there, but the one I want to focus on is the third one, which in a way is the critical crossover and the link to the NCD agenda. And that's around dementia risk reduction. So in simple terms, the main risk factors for non-communicable diseases also happen to be, and also are, the risk factors for dementia. So that is another simple point, which is that it's a win-win situation. So if we can get out of our silos and work more synergistically, we see benefit, whether you're from the NCD community, working on cancer or cardiovascular disease. If we can work on those risk factors, you will also see improvements on cognitive impairment and dementia. Just like ourselves working in dementia would also say it the other way around and say, we are working in this area. If we address the risk factors for dementia, we will also be improving outcomes for cancer, diabetes, and cardiovascular disease. But as my final slide shows, we can still do more. This is latest information about how well countries are doing in terms of their preparation. They're having, for example, guidelines for dementia risk reduction, or a campaign or a program around risk reduction. And you can see that it's less than half. And most of those countries are high-income countries. I think it's your money. So there's still a lot to be done. And we will now hear from several countries and stakeholders about how they believe that we can make solid progress over the years to come. So thank you and welcome again.
And now it's my great pleasure to introduce us to our wonderful panelists. And thank you so much, Dan, who are going, we put a similar question to everybody around, so now that we have this declaration, what is going to happen at government level, at personal level for someone that is experiencing the disease, at NGO level and at country level. So how is everybody going to react to this? What can we do? How can we implement it? What are the next steps? So this is what we want to discuss, and we want you to have some ideas of what could be done. And it's important for us to have governments here that will tell us what they are doing, because that's how things will actually happen. So we are delighted to be joined by His Excellency Budi Sadikin, the Minister of Health and Government of the Republic of Indonesia, Judith Thielen, who is the Minister of Youth, Prevention and Sport of the Netherlands, Dr. Mariangela Batista Galvão Simão, Vice Minister of Health, Brazil. I hope I did that well. Her Excellencies Mrs. Maritza Chan Valverde, Permanent Representative of Costa Rica to the United Nations, Reverend Dr. Cynthia Huling-Hummel, who is the person who lives with dementia and a dementia advocate, Dr. Joan Pike, the CEO of the Alzheimer Association, who is also hosting us this week in New York, so thank you so much, and Katie Dane, the CEO of NCD Alliance, of which we have been members from a long, long time ago from the start. So thank you, panel, and it's Your Excellency turn first. Budi Sadikin, and thank you for being with us today.
Dementia is new for me, so I just involved in dementia last year after I met with you. Because to be honest, Indonesia has a lot of NCD issues, but if I prioritize when I joined this position by the end of 2020, stroke is #1 killers, heart disease is #2, cancer is #3, and then kidney disease is #4. So dementia never appears on my list because I know my limitation at that time. I only have 3 years as health ministers, and the president extended my term for another 5 years. And then I realized also that my mother-in-law, got Alzheimer about 4 years ago, and it was a very miserable life. I just realized that Alzheimer is part of dementia after I met with Paula last year. So it's not only about policy implementation, but it's also about personal experience that I had. And it is not nice to have our family with Alzheimer or dementia. So I learned, and then what we did this year, at the beginning of this year, #1 is I realized we need to educate more of Indonesian people about dementia. Because Indonesian population are young. So dementia, Alzheimer, Parkinson is not the diseases that we frequently observe in our communities. So that is the way that we need to educate our people. So massive education now we are doing with Alzheimer Indonesia organizations, Paula branch in Indonesia. I am also very glad that we receive a huge loan from World Bank, and we invest also on the screening functions. I just know that dementia, the best screening tools is using a PET scan. You can imagine when I joined in December 2020, Indonesia only have 1 city out of 540 that have PET scan. Can you imagine that? So like example, in US, you only have PET scan in New York. So if somebody got cancer or dementia in San Francisco, you have to send it to New York. Indonesia have 1 PET scan on December 2020. Now we already have 8. Hopefully by the end of 2037, because of the loan, we will have 16 PET scan plus additional about 14 PET CT. And we will have around 10 cyclotron across the country before we only have 1 cyclotron. So hopefully with this new infrastructure by 2027, the diagnostic screening will be available. What I realize also is that dementia, you can do massive screening using interview. I just realized the tools that we can use. And we are lucky that February this year, we just launched the most ambitious screening program for the country. 280 million mandatory screening program every year. For newborn screening, 5 tests, the children, 13 tests, including mental health, adult, including elderly like me. So what we did, we will include dementia screening questionnaire into the elderly screening. Since we launched our ambitious program in February the 10th, now 30 million Indonesians already took the screening with the running rate of 500,000 a day, because we have 10,000 primary healthcare clinics across 7,000 islands, was built before my time, which now we can utilize, and thanks to COVID, we can revitalize these 10,000 primary healthcare clinics owned by the government, now to do more, including screening, that is including dementia. And one thing that I realized also in dementia, it's very similar with, cardiovascular diseases. I identified there are 14 risk factors, and 10 of them are clinical. And most of them are related very closely with cardiovascular, like alcohol level, diabetes, inactivity, obesity, etc. So these are the indicators that we already included in the mandatory annual screening to our people. And then if there is a red indicator, red flag, like I give you an example. If your blood pressure is 120 and 80, that is green. If it is below 140 and 90 is yellow, but it's above 140 and 90 is red. So we use color to make it easier when somebody receives a WhatsApp messages that you have 10 indicators, 8 greens, 1 yellow, and 1 red. So then you need to change that one. So this is something that we'd like to push, and it's valid for myself. In December 2020, my BMI is about 28. Then become Minister of Health, I realized that, BMI 28, I have a pretty high cholesterol level, blood pressure is okay, but the HbA1c is about, at that time, is about 7, which is borderline, or it's quite high. I realized the best way without taking medicine is change your lifestyle. So when I reached 60 last year, after meeting with you, I realized dementia, you need to have a good cardiovascular situation. I put to myself a promise that I would like to start my first marathon when I reach 60. So I managed to run marathon when I was 60 last year in Berlin. So hopefully next month I will run my second marathon in marathon. My BMI went down from 38 now to 33.9, borderline. And my blood sugar, my cholesterol level, and blood pressure become pretty good. So all are green. So thank you for Paula. You remind me that, hey, Budi, you are already 60. 60 in Indonesia is categorized as elderly. You get free discount everywhere, which is good, but it's like intimidating because the government say that you are old, whenever you are elderly. That's why I need to live healthier. And I do hope I don't replicate, what happened with my mother-in-law. And the last thing that I would like to do, which is I haven't done it, but I really want to do it because I experienced with myself. Taking care of dementia patients can be quite irritating. So I strongly believe that I would like to create a training program for families with elderly, how to take care of dementia families, if there is a dementia patient in your family. Because in Indonesia, it's very rare if you have a grandpa or grandma, you send it to the, other houses. Usually you take care by yourself, but you need skill, you need patience, you need tools how to do it. And that is something that I would like to do, to give the tools, the education, the skill for every family, to take care of their parents. Thank you.
Thank you very much for your experience, Budi, and for making it in practice and telling us practically why you're doing it and having the capacity now to help the 300 million people that are in Indonesia. That's a big challenge. So we all thank you and wish you the best with this giant program. Judy, now will you tell us what our model country, the Netherlands, the country we all look at with great inspiration, is doing?
Yes, thank you, Paula. I will. But let me ask you first a question. Who of you has a family member with dementia? Please raise hands. Yes, which is the majority of the people in the room. And the mother of my best friend, which I know for all my life, also has dementia. So I think we all know 1, 2, 3 persons that has dementia. And as you said in your introduction, our population is growing older, so the number of people with dementia is growing as well. I heard the numbers from you. I put them down as well. I can name them again, but I won't, because it's a massive amount of people. So even more of the people in your environment will also be suffering from dementia. And it's not only the people themselves, as you said, and as we all realize, but it's also the people who live with them, who needs to take care of people with dementia. And it's not from the one day to the other day that dementia is impacting it so vastly. It takes time, and you don't know where it will end, which makes it also very worrying. In the Netherlands, dementia takes largest part of our healthcare expenditure within a few decades. The burden on the healthcare systems and the healthcare workers especially is already enormous, and it will continue to grow, not only with us, but also with you. I'm always trying to be positive, and luckily there's also good news. New treatments for dementia are being developed. They're still in a very, I call it developing phase, but they are being developed. And delaying onset remains just the most feasible option for us to provide individuals with more healthy years, as science will catch up over the coming years. We also know now that up to 45% of dementia cases could be prevented or delayed by addressing, and I think you mentioned them as well, the 14 risk factors, which are also in line with other risk factors for other NCDs. Like you said, smoking, very important one, obesity, physical inactivity. And I think here lies a crucial task for governments to enable prevention. We must address these risk factors with strong policies, which is complicated, because we all know that changing behavior and changing habits is never easy. Mr. Bundy is very good at it, but I think you're more the example than the rule, to be honest. And that's a compliment. In the Netherlands, we've developed a national dementia strategy. It was started in 2021, and it runs to 2030. And the mission of the strategy is for people with dementia and their loved ones, of course, to be able to function as valued members of our society and receive good support and care. We are striving for sufficient scientific research into possible prevention, treatment, and cure, hopefully. In the strategy, we described 3 themes. The first one is to eradicate dementia through scientific research. The second is to positive societal attitudes towards people with dementia, like you mentioned as well. And the third one is tailored support for people living with dementia. And for people living at home with early stages of dementia, which is 71% of the Dutch diagnosed people with dementia still live in their own home, in their own family. And there are many options for care, for activities and support for them. But strategies and policies are only part of the story, because behind the numbers and the plans, as you said also, are the people. And there's something we don't talk about enough when we discuss dementia, also in our countries, how it affects women. Dementia does not just affect memory, it affects identity, it affects relationships, it affects daily life. And for women, the impact is very significant. Women are not only more likely to develop dementia, did you know? Most of you maybe don't, I didn't a few years ago. But they are also more often the ones taking care of the loved ones living with it. So, and that we do know, but it's a heavy burden. So women carry the burden twice. In the Netherlands, researchers are beginning to look more closely at the differences between men and women. We know that dementia often progresses faster in women and sometimes shows up in ways that are harder to recognize. Too often, This means that a diagnosis comes late, sometimes after years of uncertainty, when the damage to the brain is already substantial, and yet women remain underrepresented in research. And that gap matters, because without understanding the differences, we cannot respond properly. So that's my call, to focus also on the differences between men and women. Right now, almost 300,000 people in the Netherlands are living with dementia, and 2 out of 3 are women. In most cases, it takes longer than a year before a diagnosis is made, and 70% of those caregivers are women themselves. So in Dutch homes, it is often women living with dementia and women caring for those with dementia. They seem so subtle, those differences, but they add up to something bigger. They affect how quickly dementia is recognized, how families cope, and how research is designed. That is why awareness matters. Because if we speak about dementia without naming the specific impact on women, we miss more than half of the story. The Dutch National Dementia Strategy has taken an important step forward, but if we truly want a dementia strategy that works for everyone, we need to put women's health at the center of the conversation. So I hope we can continue this conversation, keep sharing the many good examples, like in Indonesia and also in your countries. And I think we can learn from each other, share insights, share knowledge in order to indeed, well, let's say, beat dementia for both men and women. Thank you.
Thank you so much, Judith, and also thank you for shining a spotlight on the issue of treble jeopardy, the way that women are hit in so many different ways, because we hadn't really mentioned that earlier, but it's so true. Now I am going to hand over to you, yes, of course, and I thank you massively for being here. Your country has only just passed a dementia plan. For us, Brazil has been one of our biggest target countries, and it's been with enormous joy and relief to an extent that we've seen it join the ranks of those that have acknowledged there is an issue. So I'm delighted that you're with us. It's the first time Brazil is with us on a panel, so the floor is yours.
Thank you, Pablo. You know, first of all, let me thank you for inviting us to Brazil to come here. And actually, this is a concern for our country, and it's something we share with high-income countries. At the time that you have problems, we have problems you don't have anymore. You know, so it is, in a large demographic transition, is putting a burden on our countries, you know, because at the time that we didn't solve yet the problems with malaria and leprosy and so on, we had to deal with people getting older. I'm getting older too, so yeah, we are, right? Yeah, but anyway, let me say that I need to say something, because the Minister of Health of Brazil is not here at this UNGA, because he got a visa that restricted he could move only 5 blocks around the UN. Yeah, you know, so he didn't come, you know. And this is a violation of the agreements we have with the UN and this country and so on. And so we are missing his presence here. He's an infectious disease doctor, and I'm a pediatrician by training, but, you know. But he's very keen on health care in Brazil, you know, and so we miss him here. And then, you know, I think we all, and following this declaration, I think we all of us who deal with public health, you know, we need really to stand for decisions that are made on scientific basis. You know, this is what we should all, because we're seeing things that are inexplicable, you know. Anyway, moving to, it's a complex world, let's say. Like the Chinese would say, it's an interesting world, but it's very complex. But, you know, Brazil has a national health system. We call it Sistema Único de Saúde. It was inspired on the British and now British health system, but now it caters for 75% of the population in total. And in the northern part of Brazil, it's almost 100%. You know, and for diseases, chronic diseases, it's mostly they get dropped by the the private sector, right? Although there are increasingly regulations that try to curb that, but that happens. And then I would divide, because we do have some data, which is important to highlight, because I had a boss once who used to say that you measure what you treasure. Right? If we don't measure, you don't know the size of the problem, and you cannot highlight anything. So in 2024, we did a national report on dementia, which brought some light, but not enough yet. But what did we found? We found that the prevalence of dementia in Brazil was around 2 million people, which I think is underestimated. Not because Brazil has more than 200 million people. But still a big number, right? I don't know what about Indonesia, but you mentioned it. And we estimated we have 300,000 cases, new cases diagnosed every year. This is all estimations, but it's what we have right now. Most cases, including Alzheimer's, occurred in Brazil in individuals over 70. I'm going to be 70 next year, so I'm worried. And so Alzheimer's is the most common disease. It's accounts between 60 to 70%. And then we have the data now, and then we're working on the healthcare part, right? And it's good to hear that talking about the prevention, because I was checking our plan doesn't have prevention. Yeah.
We should have picked you up for that.
Yeah, because the Brazilian health system is very hierarchical, and it works, it's the same health system across the country, and it has 3 levels. The city governments have responsibilities, primary health care, the state governments have the responsibilities, and the federal government has 2 responsibilities. One is the normative side, and the other is the financing side, okay? But on the normative side, we do have a national policy for attention for people with neurological diseases, which include dementia. Right? And there are all the right things are there, except prevention that I didn't find, okay? But like multidisciplinary support for patients and families, professional training and early diagnosis, scientific research, because there's so much that we don't know yet. Inclusion of communication, because to raise awareness, this is super important. But we are focusing on raising awareness for early diagnosis, and maybe we should include, our minister, you know him. He runs every day at 4 o'clock in the morning. I don't do that, but but I admire those who walk the talk. Okay? And also it includes a participatory approach, because Brazil is very strong on social participation on all decisions, the health sector and so on. But is this, I think we have gone some ways, but there are so many challenges ahead of us. Part of it is related to people who are diagnosed getting the attention they need, and many times it's more than the health sector. That's what the sector. Sectorality is very difficult to improve, because social protection is something that's needed in these cases. Families need support as well. And when I look at what we had and what we have come so far, I think that recognizing the problem, estimating the needs, it's a big step. But then we need to move forward. And so we reaffirm our commitment to push this to advance public policies and aimed at the health of the elderly, because it's related, right? And people affected by dementia. But I would say, I would finalize with something that some people here may not have heard, but people who are older will have. Because I think the saying during the Frelimo, the Mozambique liberation, a luta continua e a vitória é certa, and the fight continues, but victory is certain. Maybe The fight continues, but victory is uncertain. We are seeing that here in this country. So let's keep on fighting, and we count on all of you to push the governments to do the right things at the right time. Thank you.
Thank you so much. This was an intervention we needed, and also you mentioned the word fight, and of course all of us Alzheimer's Disease International like that, like the idea that we continue to battle. Now we're going to interrupt this for a second as we welcome our ambassador, who should be almost there. So if everybody could please stand up. Not Your Majesty, of course. Excuse me. Please, everybody, be seated. Your Majesty, Your Royal Highness, His Excellencies, Your Royal Highness in ADI Red, we very much appreciate that. So thank you, everybody, for this small interruption. We will continue the panel. And we are now going to hand over the floor to the Ambassador of Costa Rica. Costa Rica is a country that I had the pleasure to visit early on in my tenure at ADI, and I was amazed by their approach to dementia based on human rights and the rights of the older adults, los adultos mejores. So it's been a joy to see you here, and please, the floor is yours.
Thank you very much, and thank you for inviting me, Your Majesties. I'm delighted to be here today. First, let me tell you that Costa Rica is a very small country. We are 0.6 the extension of Brazil. And in the terms of the Americans, we are the size of West Virginia. Nevertheless, since the 1940s, we established a social system that is now universal. Right now, we can have determined that 30,000 Costa Ricans suffer dementia. But Costa Rica is an aging country, and we are aging rapidly. That means that we are expecting in 25 years that we'll have a surge of 400% in the cases of dementia. What we also know and heard today from the Netherlands is that 2/3 of patients are women. So this means that this is not only a health crisis, a human rights crisis, but a gender crisis. And this must give us pause. We are seeing daughters taking care of their spouses, wives taking care of their grandparents, and grandmothers forgotten by the system that they once served. And this is a moment of reflection and pause. And we really need to think of dementia now that are contrary to Indonesia. Many other countries were aging rapidly. In Costa Rica in 2014, we were the first Latin American country to adopt an Alzheimer plan. And by 2017, we mandated the standards across all providers. Now, our primary care detects cases early, and our memory clinics support families, and families support communities. At the regional level, we're also working with the Pan American Health Organization, and we collaborate with them to share knowledge, reduce stigma, and build capacity with other Latin American and Caribbean states. And as you well mentioned, what is measured is what you treasured. In Costa Rica, we say what we don't measure, what we measured is what you see. So if you don't have data, how are you going to be able to address this health, gender, and human rights crisis? And one of the major concerns for developing countries like Costa Rica is that we know that new drugs are showing promise, that technology is offering hope, and the research is advancing rapidly. But the breakthrough treatments exist only for those who can afford them. And we cannot create a two-tier world when we have people that will remember and people who will forget. So my goal today is a call to action. We must take this issue seriously, especially middle-income countries, countries that are not yet developed, but will face an aging population that will require the social services so everyone has access to health. I thank you.
Thank you very much, or pura vida, as you say in Costa Rica, for this wonderful intervention, also for reminding us of the immense amount of work that PAHO has put into the Pan-American region on this. They've been a fabulous partner all these years, so we shouldn't forget the enormous amount of work they've done, so thank you. Now it's my immense pleasure to welcome the Reverend Dr. Cynthia Hunting to this particular panel, who will give us, now that you have heard everything that you heard from the government, her own perspective on what it is actually like to live with dementia. Thank you.
Thank you. Good evening, everybody. It's an honor to be with you this evening, and I want to thank the organizers for inviting me to this historic event. I am Cynthia Hewling Hummel from Owego, New York, a little community in upstate New York, about 3 hours from here. I am a mother, a grandmother, a preacher, a singer, an artist, and I'm also a person living with dementia. I started experiencing cognitive symptoms back in 2003 when I was only 49 years old. I was having problems remembering my parishioners' names and what they'd shared with me. I had trouble navigating in my car and I got lost frequently. But perhaps the most unsettling time was when I got lost on the way to a local cemetery where I was supposed to bury a beloved member of our church family. I drove around and around, and I had no idea where the cemetery was. I had no idea how to get there. And it was a terrible situation because the family was distressed and I was in tears. Around the same time, I realized that reading was becoming harder and harder for me. And on top of that, I remembered very little of what I read. And I ended up giving away my library of more than 500 books because they reminded me of what I'd lost. I desperately wanted and needed answers to my cognitive problems. And so I went from doctor to doctor, hoping to find out what was wrong with my brain. It took me 8 years to get a diagnosis, and it was amnestic mild cognitive impairment due to Alzheimer's disease. It wasn't a surprise, but it was and is a sadness. Alzheimer's runs in my family. My mother died with Alzheimer's, so did her only brother, and my maternal grandmother had some sort of dementia. Back then we called it senility. We know better now. My doctor suggested that I step down from my role as a pastor because it was only going to get worse. When I asked him how long I had, he said 7 years, maybe more. So I decided in that moment I was going for maybe more. My church family was supportive and sympathetic, and they helped me transition out of the church and into the community. And I cried with frustration and sadness. The experience felt surreal. I felt useless. And I needed to do something that gave my life a sense of purpose. And I called the Alzheimer's Association's trial match. And I was matched with a research study called ADNI. Perhaps you've heard of it? The Alzheimer's Disease Neuroimaging Initiative out of the University of Rochester, New York. And I've been in that study now for 15 years. Being a research participant, being an advocate, and a catalyst have helped me to move from why me to what's next. I've spoken about my diagnosis and about my strategies for living well with dementia in various settings, from faith communities to medical schools, to research summits and special events like this one. My friends, it is such a hopeful time for those of us who are living with a diagnosis and for our carers. I was at the 2025 Alzheimer's Association's International Conference in Toronto, and the attendees, we cheered when we learned about the new ways to diagnose dementia, the interventions to treat Alzheimer's disease, as well as to potentially delay dementia through lifestyle changes. It's also been very exciting to hear of the new medications that have been approved and to learn about those that are in the treatment pipeline. We've come so far, and at the same time, we have so far to go to ensure that all people all around the world have access to quality dementia care. In my mind, one of the challenges we face on a global level is to reduce the stigma of a dementia diagnosis and also to normalize Alzheimer's and dementia. And that's why this week at the UN, we have been talking about including this in the Declaration of Non-Communicable Diseases. And we have such an opportunity in doing so to increase the visibility of dementia and to shine a light on many of us who share risk factors and with this and other conditions. So we have to take an opportunity now to work more collaboratively. Imagine a world where dementia is working hand in hand in areas like cardiovascular disease, with cancer, diabetes, and obesity, to raise awareness about how to reduce those risk factors of dementia. Imagine a joint awareness and public health campaigns across the world. We need to encourage our leaders in various roles and settings around the world to fund programs that would provide a variety of resources and opportunities for their constituents that focus on reducing the modifiable risks associated with dementia, as well as offering appropriate care for an individual in his or her setting. Today is all about working together for the common good. It's critical that we come together and work together to educate and resource people, because this is key to our moving forward to end Alzheimer's and other dementias. And may it be so. Thank you.
Thank you so much for this fabulous intervention, Cynthia, and for telling us how it is in reality, which is something we all need to hear from all kinds of point of views always, and this is why it's so important. Now I'm going to pass the floor to Joan Pike. Now, the Alzheimer Association is the strongest of all the Alzheimer Association globally. They've grown wonderfully well and really embedded themselves, and this has carried a lot of weight in all of our community for many, many reasons, research in particular, but not just that, really every single element in a country that has a lot of challenges. And Joanne, I know that you know a lot about NCDs, but in particular, I'm sure you want to share with us what's happening with the study that you've been doing that is going to really shine a light on risk reduction and what could be done and what really could be achieved with that. Please, over to you.
And thank you, Paula and Dan, for the invitation to be on such a wonderful panel at an appropriate moment in time for so many reasons. And I want to acknowledge really quickly what Paula started with, which is this incredibly historic moment that dementia is on the NCD declaration. At a moment in time where we are seeing so many advances right now in research, in how we treat, how we diagnose, how we provide care, it is so appropriate that at this moment in our global movement, we have this convergence happening right now. To Paula's point, I am going to talk a little bit about implementation, but also imperative on that front. And Dan really opened us up with the focus on risk reduction. The Alzheimer's Association has certainly, over the last several years, made a concerted commitment to learning more about how can we focus on risk reduction. very much centered on what we learned from the finger trial from years ago around reducing risk in Finland through Dr. Mia Kivipelto, but how we apply that to a diverse population like we have in the United States, where we have to think about how different lifestyle interventions in risk reduction can look for a population that has very different nutrition across the country, very different access to physical activity. And so making sure that we research and study how we can drive risk reduction in that diverse population was incredibly important for us. And so we launched US Pointer with the very intention of thinking about how can we change cognitive impairment here in the US like we have seen in Europe. We looked at a structured lifestyle intervention, really focused on nutrition, physical activity, cognitive engagement, and heart health. Some of the very things that also apply to NCDs across the board, and things that we know that can change mortality, but how we apply that to cognition. And what we learned over that 2-year study through that intervention is that regardless of the level of intervention, we can have impact on brain health decline. Now, I mentioned the level of intervention because when we did this research study, we looked at 2 arms of that intervention. A very intense lifestyle intervention that had much more accountability built into it over that 2 years. And then a self-help, self-guided intervention that had much more low touch, but also lower cost to implement. Both of those interventions showed improvement, but certainly the one that had more accountability structure, more high touch, had higher outcomes. In fact, outcomes that really looked like an addition of 1 to 2 years younger from a brain health perspective than the self-help or self-guided group. So knowing that we could intervene at a higher level and create longer brain health is something that we were able to, from a very rigorous trial design, show and announce at our Alzheimer's Association International Conference in Toronto. Now, those results require commitment. It's one thing to know them, but it's another thing to commit to changing how you define and deliver public health and what we know about brain health within this country. So as a result of that, knowing that we had this 2-year trial design, we wanted to extend our ability to monitor those individuals who participated, but then also begin to look at how do we implement this in other locations that not go from rigorous clinical trial to real world type of intervention. As a result of those decisions, the Alzheimer's Association is investing $40 million over 4 years to extend our follow through on that research study, to monitor those individuals, but also to look at implementation research at the community level that is defined by the community, that is defined by the health system, and looking at how you can take that intervention and build it for that location and that setting. Now, US Pointer and the example of how you can implement risk reduction is one side of this equation. The other piece to this, and I think an important side of why it is imperative to have dementia in the NCD agenda, is on the imperative to manage NCDs and dementia together. We know that dementia complicates the care of NCDs. Consider how an individual has to manage cardiovascular disease, how they have to manage diabetes, and then consider cognitive impairment on top of that. We know these are inextricably tied together. You cannot manage an NCD without considering the cognitive impairment. And you cannot manage cognitive impairment without considering the chronic comorbid conditions that go along with them. The very fact is not only this about healthcare and the healthcare delivery system, but it also is a cost variable as well. So as individuals have to manage their NCD without managing their cognitive impairment, they may end up in the emergency room more often. They may end up needing higher level intervention over and over again. You have to be able to bring those two items together. As an example of that cost equation, healthcare costs in the US increase by almost double when an individual has both chronic condition and dementia compared to chronic condition alone. In order to make sure that these conversations at a global scale continue to come together, this moment in time, having dementia on the NCD agenda gives us the leverage to continue to build that knowledge and the policy structure to support managing on those fronts. I think we've heard also several times that the global population is aging. It's critical that we consider how dementia across these comorbid conditions is managed as we see a higher level of an aging population over time. And not only that, this moment is really a call to action for NCD leaders, along with Alzheimer's and dementia leaders, to bridge that landscape and elevate what this conversation needs to be. So thank you for the time and the opportunity, and congratulations.
Thank you, Dawn. This is such an important point. So this is a real practical issue here. We are on the verge of an incredible change in the way that we think about dementia and what can be done to actually reduce those numbers. And this is really critical right now. And it's my pleasure now to hand over the floor to Katie. I think there's a lot of things in our mind right now. So an epochal declaration, working with the NCD community better, what can we do? And how can we also integrate these at the moment that we know that the reporting numbers for the NCDs are not quite including dementia yet? So how do you think we're going to do that so that dementia is fully included in the NCD discourse? And I'm sorry to say that probably there won't be much time for questions at the end of this panel because we'll try and finish it promptly after our last speaker. Thank you.
Thanks, Paula, and thank you for the invitation for joining you tonight. I mean, I think, firstly, it's really nice to be at an event where people are celebrating the political declaration on NCDs. I feel like I've been at a lot of events the last couple of days where people have been bemoaning it and highlighting the disappointment. So it's really nice to be at an event where people are celebrating this new declaration. And let me just join others in saying huge kudos to ADI and everybody in this room for making this happen in terms of the inclusion of dementia in this declaration. It's not easy. You know, we've been involved in all of these high-level meetings on NCDs since 2011, and then 2014, and then 2018. And we know how hard it is to really get the issues on the agenda. So kudos to you and everybody in the room for making that happen. You know, as others have said, you know, this is the fourth high-level meeting on NCDs. Each attempt has been to try and get non-communicable diseases, and in our eyes, the NCD Alliance's eyes, that includes dementia, neurological conditions, higher up the political agenda, not just within Ministry of Health agendas, but also heads of government, heads of state, ensuring that there are strong political commitments coming out of these meetings. And particularly at this moment in time, that's not easy in terms of the geopolitical context that we are living in. But, you know, I think I'd like to just kind of take a moment just to kind of recognise actually how dementia is included in the declaration. As others have said, this is going to be approved on Thursday by member states in the UN. You know, there's a specific paragraph in the new declaration that recognises the burden of neurological conditions, including Alzheimer's disease and other forms of dementia. There's another whole paragraph that recognises that NCDs and mental health and well-being are closely intertwined with brain health and neurological conditions. There's specific reference to the need to tackle stigma and discrimination of neurological conditions. There's recognition of ageing populations and the importance of policies and programs that promote healthy and active ageing. And there's also, going to Joanna's point just there, that the recognition of multi-morbidity, comorbidity between dementia and different NCDs, and the fact that dementia needs to be recognised at the primary healthcare level. So that's all to say that that is, huge kudos again to this community for getting all of that included in one declaration. But as you say, I mean, the big question now is what next? After these weeks, after high-level meetings, after us all running around like headless chickens in New York for a week, how do we actually translate what we have in that document into tangible and concrete action on the ground? I don't think I've got all the answers to your question, Paola, but I think that there's a few things to highlight. I think firstly, it gives an entry point and further legitimisation of joint advocacy across the dementia community with the broader NCD community. We at NCD Alliance have been trying to do that for many years. I think it needs to happen at a much greater scale and speed at the national and at the regional levels. The NCD Alliance is very proud that we have 75 national and regional NCD alliances today, many in low and middle income countries facing the biggest burden of these diseases and conditions. And I think there are always opportunities to be making sure that those alliances, whilst we don't control who are part of those coalitions, are really embracing the dementia community as much as they are the cancer community, the diabetes community, cardiovascular, etc. I think the other thing is that there's obviously a real opportunity here in terms of joint advocacy. Joint advocacy around the primary prevention agenda. We've heard so much tonight about the risk reduction side of dementia. And obviously that link between, the risk factors in NCDs, tobacco control, unhealthy diets, reducing alcohol, and air pollution being an important one as well. Now, obviously, increasing evidence around that being important for dementia. And that gives us an opportunity from an advocacy perspective to focus on what works in terms of reducing consumption of unhealthy products. And in NCDs, we have what's called the WHO Best Buys, which includes many of the interventions and public health policies that we know work, including things like taxes, front of pack labelling, marketing restrictions to reduce consumption of these products that then obviously kind of have an impact on NCDs overall. I think secondly, there's an opportunity, and this goes back to the risk reduction agenda, of really kind of scaling up, joined up awareness raising and public health campaigns at the national level, regional level and international level. Again, linking the two agendas together around tackling those risk factors that we know are modifiable. And then finally, to your last point, I think, and again, I don't have all the answers to this, but there's obviously a disconnect at the moment, both from a policy perspective as well as a kind of monitoring and reporting perspective between dementia and NCDs. Most countries have essentially a national NCD plan. They also have a national dementia plan. At WHO, it's the same at the global level. And then the way that countries are reporting on NCDs and then dementia tend to be separate at the moment. And I think there's an opportunity at the global level, perhaps next year, as WHO on the NCD side of things is updating its own global monitoring framework on non-communicable diseases, which includes a set of targets and indicators that the world is using to measure progress against this very big agenda. Perhaps there's an opportunity there to be making the connections between the way that NCDs are tracked and monitored and also how dementia is. So a few examples, but I think I'd like to just kind of underline the fact that, this week, the words of the declaration, a fantastic start. It will take everybody's energy and commitment to really kind of translate that down to the national and regional levels.
Thank you, Kingsley.
Okay, so we've just finished the panel. What an incredible panel it was. So different, the perspectives and the contributions. So what I did during the session was to write down 3 words that caught my attention and seemed to sum up well the conversation. The first word is complexity. The complexity of the needs, the issues around it, and the multiple perspectives that we heard from everything from lived experience to policy to programming, gender perspective, rights, and so on. So this was one angle, one word I wrote down. A second one was synergy, so the opportunity for working closer together, more collective action and identifying other agendas. In this particular case, the connection between dementia and the other NCD agenda. And the third word, and the final one, which I wrote down, was hope, in the sense of the conversations that we had were very positive and indicating fruitful ways in which we can move forward. Again, with very positive lived experience testimony that we had, but also from the other panelists that spoke to how they see profitable and feasible ways to move forward together on this agenda. So that encapsulated for me some of the conversation this evening. Thank you.